All right.
I'm going to begin by performing hand hygiene. Next, I'm going to provide my patient with some privacy. Hi, my name's Missy. I'm going to be your nurse for today. Can you just say your name and date of birth for me, please? Okay, I'm going to verify with his wristband. Good. I'm going to explain the procedure to my patient. I'm going to be doing a dressing change today. Do you have any questions? No? Okay, before I begin, I would just like to ask you a few questions. Can you rate your pain level on a scale of 0 to 10 for me? Okay, good, no pain. I'm also going to make sure he doesn't have any allergies to latex. And then I'm going to put him in the appropriate position, which he already is in. Now the positions vary depending on where the wounds are. Jimmy happens to have an abdominal wound, so lying down is how we're going to assess it and change it. Okay? All right. I'm going to do my best just to expose the needed, the area, just the area. Trying to keep privacy as much as I can. I'm going to put my chuck down for trash. Okay. Now I'm going to remove the ABD pad. I'm going to do this by pressing down while pulling up on the tape on the edges. This is to help prevent further tearing of the patient's skin. And if the tape is being stubborn, just get an alcohol swab and like moisten the tape and it should come up easier. Just want to be careful that you don't hurt the patient further. All right, now that the tape is removed, I'm going to remove the bandage. I'm going to look at the bandage for any discharge, and if there is discharge, I want to note how much, and I want to note the color. Along with discharge, I want to know if there's an odor. There's no discharge and there's no odor, which is good news. I'm now going to take note of how many 4x4s were used for packing. I'm going to remove them, and now I'm going to assess my wound. I want to assess my wound for granulation tissue, which is present, healthy granulation tissue, indicating that healing is in process. I'm now going to check for bogginess. Bogginess indicates if there's tunneling. And Jimmy here has no tunneling, which is good news. Now I am going to measure his wound. I'm going to do so in centimeters. Careful not to touch the wound, but to just hover right above. I have 13 centimeters long and 2 centimeters wide. Next, I'm going to measure the depth. I'm going to do so by using a cotton tipped swab. I'm going to go to the deepest area of the wound, and I'm going to slide my fingers down to where the skin once was. I'm going to pull up, and I'm going to measure where my fingers, where my fingers met, and it says about 2 3/4 of a centimeter deep. I would note this, these findings in his chart, and now I'm going to prepare my sterile field. I'm going to do so by first removing my gloves, performing hand hygiene. Normally I would wash my hands, but for time reasons I'm going to just use Purell. Okay, I'm going to get my tray ready. I'm going to open my tray away from me. Okay, I'm just going to rub my hands a little bit more just to make sure that they're dry. Getting the sterile field wet indicates breaking in sterile field. I cannot touch the upper lips of this container, so I'm being careful just to touch the bottom. I'm going to grab carefully the sterile field from the container. Very careful not to touch anything, except the 1-inch border. That is allowed. Okay. Staying within the 1-inch border, I'm going to lie my sterile field down. I'm going to then carefully, not touching the surface of my tin, and I'm going to dump the contents in the middle. Okay. Next, I'm going to pour some saline into my tray. I'm going to make sure that if it's not opened, I'm going to look to see when the expiration date is and when it was open. And I also want to lip it before pouring anything in. But since this one hasn't been opened, I can just pour straight from the bottle. I'm going to pour about 4 to 5 inches above, being careful not to splash my sterile field, because that would be a breakage and sterility. I'm next going to don my sterile gloves, not turning my back on the sterile field. Okay. Personally, I like to put my sterile gloves on my my non-dominant hand first, so that's what I'm going to do. Being very careful to only touch the outside cuff. I'm going to just slide my finger in there, pulling it down round and round. Okay. Alright, now for the next one, I need to be careful to only touch the inside, or the outside, excuse me, of the glove with my gloved hand. Once again, my bare hand can touch the inside of the glove. I'm just going to do the same thing. I'm just going to pull on. You can arrange once they're on. Okay, just touching the outside of the gloves. Good. I'm now going to come over to my sterile field. I'm going to just organize my stuff as accordingly. Okay, I'm going to drop my 4x4s into the saline solution to soak for a little bit. Keeping within the 1-inch border. Okay, I'm going to first start by cleaning. I'm going to do so by coming over to the wound. I'm going to start in the center. Make sure you have 3 swab sticks. And I'm going to go top to bottom, least contaminated to most contaminated. So you want to do a twirling motion down the middle, discard, and you're going to do the same twirling motion towards one side, top to bottom, discard, and then same thing just on the other side. Twirling motion top to bottom. Okay, now I'm ready to pack the wound. This hand is about to become clean. I'm going to grab my forceps before beginning. Now once this gets wet, it is clean, so keeping that in mind while packing. I'm going to drain out the excess saline. And I'm just going to kind of play with it to try and get it like fluffed out again. You can use your forceps here. Okay. Now I like to roll, okay? So I'm going to come over to my wound now. Once again, just going to feed in the 4x4 into the wound. Careful not to touch the outside. I'm going to repeat this with the other one. Once again, draining the excess water, and then I'm going to fluff it out. I like to keep a distance from my tray in my sterile field because this can be kind of a messy task depending on how much saline you put into the tray. Okay, once again, careful not to touch the forceps to my hand. or my clean hand. Okay? I'm going to come on over to the wound, and yet again I'm going to feed, 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 feed. Okay, now I can discard this material. I'm now going to, with using my still sterile hand, I'm going to put two 4x4s on top.
Yeah, that's not, I can't reverse it.
Okay, now on top of that, I'm going to put my ABD pad down. Careful not to use this hand. Very tempting at times. Okay. Now I'm going to tape. The sterile part of the procedure is over, so it's okay for me to go outside my sterile field. Really, I could take off my gloves if I preferred, but they're keeping me warm right now. Okay. You want to tape all 4 edges. Okay. Okay. And like I said, the sterile part is over, so you know what, just to show you, I'm going to take these gloves off, and I'm going to get the last piece of tape that is stuck, and I'm going to come over and put it on the last side. Now, very important step to this is you want to date, put the time, and put your name on the dressing. This is for the next nurse to know. You can do this on a separate piece of tape and then place it on. Do not write on the bandage. It's going to cause more pain to the patient. Okay. Next, I'm going to clean up my supplies. Okay. Discard my material. And then I'm going to restore privacy to my patient and comfort. I'm going to put my patient in the lowest position of the bed, put the side rails up, and wash my hands. And that concludes the dressing change.